This is All India Radio. We now bring you a special news program on COVID-19. Good morning, I'm Sunil Verma and with me is Subhadra Ramachandran. The headlines. Health Ministry says no COVID-19 case found in 325 districts across the country. No corona positive case in 27 other districts during the past 2 weeks. Indian Council of Medical Research says 2.9 lakh samples tested for COVID-19 so far. Group of ministers on COVID-19 to meet in New Delhi this morning. Central government asks states to ensure safety, shelter and food for stranded migrant workers. Centre releases 7,300 crore rupees to states and union territories under Mahatma Gandhi National Rural Employment Guarantee Scheme. Uttar Pradesh becomes the first state in the country to start pool testing of coronavirus samples. And in cricket, IPL 2020 suspended indefinitely. The government has said 325 districts in the country have not reported any coronavirus case so far because of actions initiated at the field level. There are 27 other districts also where no positive case has been reported since the last 14 days. As per the Health Ministry data, 1,320 fresh confirmed cases of COVID-19 have been reported in the last 24 hours. As many as 1,515 patients have recovered and been discharged from the hospitals, while 420 patients have died so far. Briefing media in New Delhi yesterday, an official from Health Ministry said the implementation of containment strategies in some districts, which had earlier reported COVID-19 cases, have yielded positive results. One of them is Mahe district of Puducherry, which has reported no case since the last 28 days. He also said the Union Health Minister held a video conference with health functionaries and field officers of World Health Organization in which a micro plan for clusters and outbreak containment of COVID-19 at district level was discussed. He said an action plan has been prepared on strengthening the country's ongoing surveillance by utilizing the services of WHO's National Polio Surveillance Network team. He also informed that the Health Minister has held an interaction with industry leaders and assured that their concerns will be addressed. The health official informed an advisory for safe drinking water practices during lockdown has been issued and the Public Health Department has been advised to augment water supplies with special focus on relief camps and for vulnerable sections of the society.
हमारे इस एफर्ट्स में अभी तक फील्ड लेवल पर किए हुए एक्शन के तहत 325 ऐसे जिले हैं जहां पर कोई भी केस नहीं आया है। हमारी केस फैटेलिटी रेट अगर 3.3% है तो हमारी परसेंटेज ऑफ पीपल हु हैव रिकवर्ड सो फार इज अराउंड 12.02%.
The Home Ministry representative said the states have strengthened their efforts in implementing lockdown measures and the situation regarding essential commodities is satisfactory. She said air, rail, road travel as well as services by cab aggregators will be suspended till the 3rd of next month.
गृह मंत्रालय ने सभी राज्यों एवं केंद्र शासित प्रदेशों को पत्र लिखकर दिशा निर्देशों को ग्राउंड लेवल पर क्रियान्वित करवाने तथा आम जनता के लाभ के लिए इनके व्यापक प्रचार पर जोर दिया है। लॉकडाउन के अंतर्गत 3 मई 2020 तक संपूर्ण देश में हवाई, रेल और सड़क मार्ग से यात्रियों का आवागमन बंद रहेगा। टैक्सी, ऑटो रिक्शा और साइकिल रिक्शा सहित कैब एग्रीगेटर्स की सेवाएं प्रतिबंधित रहेंगी।
A representative of Indian Council of Medical Research informed that over 2.9 lakh samples have been tested so far. He said 176 labs under ICMR network and 78 private sector labs are conducting COVID-19 tests in the country. He also said it is important for people to understand that the rapid antibody tests are not for early diagnosis but for surveillance and to monitor whether coronavirus hotspots in the country are increasing or decreasing. The ICMR official said 5 lakh rapid test kits are available in the country.
2 किस्म के रैपिड टेस्ट जा चुके हैं। एक लिवजॉन कंपनी का है, एक वॉन्फ्लो कंपनी का है। ये जो टेस्ट किट्स हैं, इनकी संख्या लिवजॉन की 2 लाख और वॉन्फ्लो की 3 लाख है।
On the occasion, a government official, while listing out several measures taken by the central government ministries, informed that over 16 lakh free meals have been distributed by the Indian Railways till yesterday.
A meeting of group of ministers on COVID-19 is scheduled to be held in New Delhi today. The meeting will discuss different issues related to coronavirus pandemic and lockdown imposed in the wake of it. Cabinet Secretary Rajiv Gauba has asked all state chief secretaries to ensure adequate arrangements for safety, shelter and food security of migrant labourers and stranded persons. More from our correspondent.
Mr. Gauba has asked the state chief secretaries to direct all the district collectors to review the situation. He said that district collectors must appoint nodal officers for coordinating and monitoring the issues related to migrant laborers. Mr. Gauba directed that each camp should be under the charge of a senior officer. In metropolitan areas, the states have been suggested to appoint municipal commissioners to implement the welfare measures. Besides, all districts will undertake a comprehensive enumeration of migrant laborers and stranded persons and make all necessary arrangements for food and shelters to them. Psychosocial counseling can also be provided to them as per the guidelines of the Health Ministry. With Divakar Anand Kumar, AIR News, Delhi.
The centre has released 7,300 crore rupees to the states and union territories under Mahatma Gandhi National Rural Employment Guarantee Scheme MG-NREGA to liquidate pending dues of last financial year, but also the wage dues for the first fortnight of 2020-21. The Rural Development Minister, Narendra Singh Tomar, conducted a detailed review of all flagship schemes of rural development yesterday. He desired that MG-NREGA works in non-containment areas with adequate focus on social distancing must be resumed in an efficient manner. The minister said the focus should be on creating durable assets relating to irrigation and water conservation. Mr. Tomar expressed satisfaction that over 93,000 self-help group members are engaged in manufacturing of cotton protective face covers as well as sanitizers and are also running community kitchens across the country. Niti Aayog CEO Amitabh Kant has said that the government would use information provided through Arogya Setu only for medical intervention and people's data would never be used for any other purpose. In a series of tweets, Mr. Kant said, "Privacy is the key and the government has given it the highest level of importance." He said the Arogya Setu app will shield people, their families and the community against COVID-19. Terming it as a world-class Make in India product, he said it empowers people with information about the potential risk of infection. The mobile application enables people to assess themselves the risk for catching the coronavirus infection. It calculates this based on their interaction with others using cutting-edge Bluetooth technology, algorithms and artificial intelligence. While informing about benefits of the app, IT Secretary Mr. Ajay Prakash Sawhney said,
Arogya Setu is an app which is built under the guidance of government and it's built by some extraordinary people from the private sector working very closely with the National Informatics Center, and it's a brilliant effort to be able to come up with an app which can help us keep the people safe to the extent possible in this huge challenge.
Home Ministry has directed that Zoom meeting platforms should not be used by government officials and officers for any purpose. In an advisory, Minister of Home Affairs has cautioned against the use of this platform. It further stated that even private users should ensure that certain advisory regarding the use of this platform should be followed. The certain advisories mainly focus towards prevention of unauthorized entry in the conferences, and it also prevents participants from carrying out any malicious activity on the terminal of other participants. Private users have been advised to refer to the certain advisory on its website to restrict users through access passwords. The Finance Minister Nirmala Sitharaman attended the plenary meeting of the International Monetary and Financial Committee IMFC through video conference yesterday. The discussions at the meeting were based on IMF Managing Director's global policy agenda titled Exceptional Times, Exceptional Action. The members of the IMFC updated the committee on the actions and measures taken by member countries to combat COVID-19. They also remarked on IMF's crisis response package to address global liquidity and members' financing needs. Speaking on the occasion, Mr. Sitharaman outlined various measures taken in India to respond to the health crisis as well as to mitigate its impact. She mentioned about allocation of 15,000 crore rupees by the Government of India for strengthening the healthcare system and announcement of a scheme of social support measures amounting to 1,70,000 crore rupees to alleviate the hardship of the poor and the vulnerable. Army Chief General M.M. Naravane, who is on a two-day visit to Kashmir, reached the valley yesterday to review the prevailing security in the wake of the coronavirus pandemic. Accompanied by Northern Army Commander Lieutenant General Y.K. Joshi and Shinar Corps Commander Lieutenant General B.S. Raju, he visited the formations and units in the hinterland and interacted with the Jawans. He applauded them for tirelessly serving the nation amidst the scare of COVID-19. Mr. Naravane further reinforced the need to be prepared all the time to meet any emerging security challenge. The noted agricultural scientist M.S. Swaminathan has welcomed Prime Minister Narendra Modi's decision to exempt farming activities and the movement of agricultural produce from the lockdown. Dr. Swaminathan also suggested a five-pronged strategy for adoption by the central and state governments to help farmers. The former Rajya Sabha member said peasants should be provided with suitable agro-advisories to maintain good field conditions and plant health, including the needed precautions against pests and diseases. He stressed on the significance of cold storage or other storage facilities that can help farmers in keeping the produce fresh till markets open.
Food Corporation of India, FCI, has transported 3.74 million tons of food grains during the lockdown period across all states and union territories to provide grains under the Public Distribution System, PDS. The FCI has been able to move a record 3.74 million tons food grain stocks using 1,335 train loads from the surplus states during the lockdown period at an average of 1.7 lakh tons per day. This is more than double its normal average movement of about 0.8 lakh tons per day. Over 1.51 crore free LPG cylinders have been distributed so far to the PMUY beneficiaries under the Pradhan Mantri Gharib Kalyan Yojana PMKGY in this month. Under the PMKGY, several relief measures have been announced by the central government for the welfare of poor, and one of its important components is to provide 3 LPG cylinders free to over 8 crore beneficiaries of the Pradhan Mantri Ujjwal Yojana PMUY over the period of April to June 2020. For the seamless implementation of the scheme, the oil marketing companies have been transferring an advance equal to the RSP of one 14.2 kilogram refill or one 5 kilogram refill, depending upon the type of package, to the linked bank account of PMUY customer.
247 Lifeline Udan flights have transported 418 tons of medical supplies across the country during the lockdown period. Civil Aviation Ministry said 154 of these flights have been operated by Air India and Alliance Air. Air India and Indian Air Force collaborated primarily for Jammu and Kashmir, Ladakh, Northeast and other island regions. Air India operated first flight under Krishi Udan program between Mumbai and London on 13th of this month, carrying 29 tons of fruits and vegetables to London and returned with over 15 tons of general cargo material. Air India operated its second flight between Mumbai and Frankfurt on Wednesday, carrying 27 tons of seasonal fruits and vegetables to Frankfurt and returned with 10 tons of general cargo. This is All India Radio giving you a special news program on COVID-19. Let's take a look at the headlines once again. Health Ministry says no COVID-19 case found in 325 districts across the country. No corona positive case in 27 other districts during the past 2 weeks. Indian Council of Medical Research says 2.9 lakh samples tested for COVID-19 so far. Group of ministers on COVID-19 to meet in New Delhi this morning. Central government asked states to ensure safety, shelter and food for stranded migrant workers. Centre releases 7,300 crore rupees to states and union territories under Mahatma Gandhi National Rural Employment Guarantee Scheme. Uttar Pradesh becomes the first state in the country to start pool testing of coronavirus samples. And in cricket, IPL 2020 suspended indefinitely. For quick news updates around the clock, follow us on our Twitter handle @AIR News Alerts.
Uttar Pradesh has become the first state in the country to start pool testing of coronavirus samples. The move is aimed at speeding up the screening process and also bring down the cost of testing samples. State Health Department has also decided to carry out the audit of any deaths in the state due to COVID-19. The death audit will help in providing better treatment to other COVID-19 patients. More from our correspondent.
Yesterday, 150 samples were examined, dividing them into 30 pools of 5 each samples. In the pool testing method, multiple swab samples are pooled together and tested. If the result of a collection of samples comes negative, then that means all the samples in that group are negative. Pool testing of a collection of samples is done during large outbreaks to fasten the screening process and bring down the cost. Meanwhile, the spread of coronavirus is now in 48 districts of the state and 773 patients has till now found corona positive. Sushil Chandra Tiwari, AIR News, Lucknow.
Madhya Pradesh government is giving financial assistance of 1,000 rupees to each labourer stranded due to lockdown. This financial assistance is being given to them to meet their immediate needs like food and accommodation. 7 senior officers have also been deployed to monitor these arrangements in other states. A report.
Chief Minister Shivraj Singh Chauhan informed that he had discussed with the Chief Ministers of other states to ensure arrangement of ration and accommodation for the laborers of the Madhya Pradesh.
तात्कालिक आवश्यकता पूरी करने के लिए हर एक मजदूर के खाते में 1,000 रुपया डाले जाएंगे। हम यहाँ पैसा डालेंगे उनके खाते में और वो जहाँ है वहाँ ये पैसा निकाल सकेंगे। आवश्यकता पड़ी तो और पैसे भेजे जाएंगे, जो जहाँ है वहीं रहें।
Relief amount of ₹70 lakh has been transferred to 7,000 migrant workers of 22 states trapped in Madhya Pradesh due to lockdown. An amount of ₹1,000 each has also been transferred to 245 construction workers of Madhya Pradesh. Sanjeev Sharma, AIR News, Bhopal.
The total number of corona patients in the state has reached to around 1,200. So far, 55 have died of infection, while 65 have recovered. There are 842 patients in Indore and 197 in Bhopal.
As donations continue to pour in from across the country to help people in distress, a contribution by an 8-year-old kid at Bandipora in Kashmir Valley is highly inspirational for one and all. To know more, let's listen to our Srinagar correspondent.
An 8-year-old Malik Ubaid is a 4th class student of Kendriya Vidyalaya at Bandipora. In order to help the destitute and the poor, Ubaid handed over his piggy bank to Deputy Commissioner Bandipora.
मैं न्यूज़ों में सुनता था जो गरीब है उनके पास रोजी रोटी नहीं है। मैंने यह फैसला किया कि मैं भाई से क्यों बात में लाऊंगा, उससे ज्यादा गरीबों की जान जरूरी है। मैं तमाम लोगों से गुजारिश करता हूँ कि जो भी आगे आ रहे डोनेट करे ताकि जो गरीब है वो अपने बच्चों के लिए दूध ला सके, रोटी ला सके, मेडिसिन ला सके।
Notwithstanding the fact that in his piggy bank there was a meager amount of only 4,674 rupees, but depicting such a generosity by Ubaid has tried to send a message across that we, as far as possible, should contribute for the needy. Sunil Kohl from AIR Srinagar.
In order to adhere to the guidelines issued by the Union Home Ministry for the lockdown period, Himachal Pradesh government has completely restricted all interstate movement. No vehicles except permitted by the government will be allowed to ply during the curfew, whereas the individual movement shall be allowed in the state only in exceptional cases. Meanwhile, the state government has said that stern action will be taken against those Panchayat Pradhans who will conceal information regarding the arrival of any outsiders in their villages. More from our correspondent.
Rapid testing kits will be made available in the state. To increase the pace of COVID-19 testing, screening centers would be set up at all interstate barriers at entry points for medical investigations of persons entering the state with a permit. Temporary quarantine center with 15 to 20 beds would also be made near these screening centers. Chief Minister Jairam Thakur said the state government would not hesitate to take action against the Panchayat Pradhans who hide information regarding the arrival of the outsiders. Principal Resident Commissioner Sanjay Kundu informed that presently all interstate movement is banned and the state government has no plan to start bus service from Delhi to Himachal as of now. Sanjeev Sundaryal, AIR News, Shimla.
Women corona warriors are playing an important role in Odisha's fight against coronavirus. To fight corona, Jagat Singhpur District Administration has formed a team of 13 women officers to take care of different aspects to fight the corona outbreak. A report.
13 women corona warriors from Jagatsinghpur district are helping the administration in manufacturing masks, create awareness among people, counsel women health workers in dealing with people who are under institutional quarantine. These women officers are showing extraordinary examples of grit and determination. Speaking to AIR, Jagatsinghpur district collector Sangram Keshari Mahapatra says,
हमारा डिस्ट्रिक्ट में बहुत सारा ऑफिसर हैं, उसमें 13 जो लेडीज ऑफिसर हैं, हमने एक टीम बनाए हैं. जितना सोशल डिस्टेंसिंग है और मास्क पहनना और हैंड सैनिटाइजेशन, वो सारे काम में लगे हुए हैं. 13 लेडीज ऑफिसर हैं, वो सब कोरोना वॉरियर हैं. उनको हमने एक मॉडल की तरह लिया है और गांव-गांव में भी वो मैसेज हमने दिए हैं कि सारे जितने जिले के लोग हैं उनसे सब सीखें और दे आर द लीडिंग एग्जांपल्स ऑफ आवर डिस्ट्रिक्ट.
इतिश्री सिंह राठौर, AIR न्यूज, कटक.
In Gujarat, the number of COVID-19 cases has risen to 929. The state health department says 53 fresh cases were reported from Ahmedabad, 2 from Surat, while 1 each from Vadodara, Aravali and Rajkot. With this, the total number of positive cases in Ahmedabad has gone up to 545. So far, 36 deaths have been reported in the state, while 73 persons have been discharged after recovery. The government has announced various decisions to resume economic activities in rural areas. A report.
The government has already lifted ban on agricultural and fishing activities in the state. Secretary to CM Ashwini Kumar said total 39 APMCs in the state have resumed operations. Mr. Kumar said the APMCs have been asked to call selected number of farmers to avoid crowd during the procurement. Chief Minister Vijay Rupani has asked all the district collectors to facilitate resumption of oil mills, cotton processing mills and ensure the supply chains of essential goods. The government has also decided to allow construction activities related to water harvesting under Manrega. Construction activities related to roads and irrigation outside the city limits has also been allowed. Aparna Khut, AIR News, Ahmedabad.
In Tamil Nadu, the number of discharged COVID-19 patients has far outnumbered the fresh cases yesterday. The Chief Minister Edappadi Palaniswamy reviewed the situation with all district collectors through video conferencing yesterday. Later, he told reporters that the situation in the state is getting well under control. In yet another development, the Muslim leaders in the state have assured the government that the customary sharing of gruel as part of the Ramzan fast will not be held in mosques this year. The move is aimed at ensuring the lockdown conditions. More from our correspondent.
Tamil Nadu has recorded an impressive recovery rate from the COVID-19 disease, even while holding the mortality rate below 1.2%. Yesterday, 62 people were discharged from various hospitals, while the new cases reported were just 25. Meanwhile, in Chennai, the city's civic body has introduced a free pick-up and drop facility for the public to give COVID-19 test samples and also for the hospital journey of elders and pregnant women using the helpline number 1913. The State Higher Education Department has decided to put off all semester examinations for the engineering and arts and science colleges to the beginning of the next academic year. Jai Singh, AIR News, Chennai.
Karnataka government has placed order to buy 2 lakh rapid test kits from China to increase the number of tests. Briefing media persons, Deputy Chief Minister C.N. Ashwath Narayan also informed that 250 kiosks will be set up across the state to collect the throat swab of suspected cases of coronavirus. He also said that tracking of all the persons in the state who had participated in the Tablighi Jamaat event in Delhi and those infected in Jubilant Pharma Company in Nanjangud are traced by now. Karnataka registered highest ever number of COVID-19 positive cases yesterday. More from our correspondent.
Total COVID-19 positive cases have risen to 315, that includes 13 dead and 82 discharged. Among the new cases reported yesterday, 17 are from Belagavi, 7 from Vijaypura, 5 from Bengaluru and 3 from Mysuru. There are 13,413 persons under observation. Social Welfare Department managed hostels and residential schools are converted into isolation wards for those kept under observation. Deputy Chief Minister Govind M. Kajol has informed that 784 people are in quarantine in 44 student hostels and 54 Morarji Desai residential schools in the state. Sudhindra, AIR News, Bengaluru.
The Delhi government has extended its list of cluster containment zones to 60 to contain the spread of COVID-19. Area around B block in Safdarjung Enclave, house number 15 Hosrani, a block in Shaheen Bagh, East Ramnagar in Shahadra are 4 new additions to the list of containment zones. Orders have been given to seal the areas under the Operation Shield of the Delhi government. Over 270 cases were registered and 3,501 people detained in the national capital yesterday for violating the lockdown measures announced to curb the spread of COVID-19. According to Delhi Police, 346 vehicles have been impounded, while 172 cases were registered against people for stepping out of their houses without wearing masks.
In our series, Experts Speak, we bring you the views of the leading medical experts on COVID-19. Dr. Anant Mohan, head of Pulmonary Medicine AIIMS, has advised people not to take medicines like hydroxychloroquine or antimalarial without a prescription by a doctor.
Please do not take medicines such as azithromycin, other antibiotics, antivirals or hydroxychloroquine or other antimalarials without a proper prescription by a doctor. Do not self-medicate.
Dr. Neeraj Nishchal, Associate Professor AIIMS, suggested to the people to stay at their homes to avoid infection.
This is a new virus, so it has got a very big ego. It will not come to your house unless you go out and invite it. So stay home, stay safe.
While telling about severe infection of coronavirus in the body, Dr. Naresh Gupta, senior physician, said,
कोरोना वायरस जो अटैक करता है उसका मोटा अटैक जो है वो फेफड़ों के ऊपर होता है। कोरोना वायरस मान लीजिए आ गया हवा में या खांसी में, तो वो शरीर के अंदर ऐसे ही नहीं प्रवेश पा सकता है कि हमारा सांस की नली में गया और वो खून में चला गया और सारे में तहलका मचा दिया। तो उसको पहले शरीर में प्रवेश पाने के लिए एक ना पास दिखाना पड़ता है, और वो जो पास है उसका वो फेफड़े में या गले में भी आ सकता है। तो जब वो फेफड़े में आ जाता है तो फेफड़े के अंदर फिर वो सूजन कर सकता है, निमोनिया कर सकता है और तकलीफें कर सकता है। उसके अलावा भी वो शरीर के और हिस्सों में भी जा सकता है, आंतों में भी जा सकता है, गुर्दे में भी जा सकता है। लेकिन फेफड़े क्योंकि बड़े क्रिटिकल होते हैं ऑक्सीजन का और कार्बन डाइऑक्साइड का आदान प्रदान करने के लिए, तो वो जानलेवा हो सकते हैं।
Broadcast Audience Research Council has revealed that Prime Minister Narendra Modi's address extending the lockdown by 19 days was watched by a record 203 million television viewers across the country. The Prime Minister has had 4 telecasts to the nation since the pandemic began in India, and the previous record on viewership was 193 million for the second address when he declared that 21-day lockdown. The council reported that the overall TV consumption in the week ending 12th April has gone up by 38% when compared to the pre-COVID period.
The UK government has extended the lockdown till May 7th as part of the country's fight against coronavirus. UK Foreign Secretary Dominic Raab announced the decision after the cabinet meeting. He said that social distancing measures will remain in force for at least the next 3 weeks. US President Donald Trump has unveiled new guidelines meant to help states loosen their social distancing restrictions. In a briefing to governors, Trump said they're going to be responsible for deciding when it is safe to lift restrictions in their states. The new guidelines are aimed at easing restrictions in areas with low transmission of the coronavirus while holding the line in harder hit locations. Board of Control for Cricket in India, BCCI, has suspended the Indian Premier League 2020 indefinitely due to the COVID-19 pandemic. BCCI Secretary Jay Shah said that due to the evolving global health concerns regarding COVID-19 and lockdown measures implemented by the Government of India to contain the spread of the pandemic, the IPL Governing Council of the BCCI has decided that the IPL 2020 season will be suspended till further notice. The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion on COVID-19. Dr. Prasoon Chatterjee from AIIMS will participate in the discussion.
And now an overview of today's newspapers covering COVID-19 stories. The top story in the Indian Express headlines: testing ramped up, 5 lakh kits arrive from China, another 6.5 lakh on way. Fresh cases rise by over 800, government pegs fatality rate at 3.3%, writes The Hindu. Another story on the front page of the Hindu reports that all residents of Indore are set to be screened for COVID-19. The headline in Business Standard states, Stimulus 2.0 ready as PM, FM hold meeting. Financial Express report that there is no big bang package on cards. Industry seeks doubling of credit growth, tax relief, headlines are Hindustan Times. Financial Express report that Niti Aayog has proposed a stimulus of 5% of GDP to address the situation. Labour Ministry to compile data on layoffs, pay cuts is the headline in the Economic Times. Pizza scare jolts food business in Delhi, headlines mailed today, referring to a delivery man who was found COVID-19 positive. The incident has set 72 families and 17 co-workers in quarantine, writes the paper.
And now, before we end the special news program on COVID-19, the headlines once again. Health Ministry says no COVID-19 case found in 325 districts across the country. No corona positive case in 27 other districts during the past 2 weeks. Indian Council of Medical Research says 2.9 lakh samples tested for COVID-19 so far. Group of ministers on COVID-19 to meet in New Delhi this morning. Central government asks states to ensure safety, shelter and food for stranded migrant workers. Central releases 7,300 crore rupees to states and union territories under Mahatma Gandhi National Rural Employment Guarantee Scheme. Uttar Pradesh becomes the first state in the country to start pool testing of coronavirus samples. And in cricket, IPL 2020 suspended indefinitely. For details of these stories and more, log on to our website newsonair.com. And with that, we end the special news program on COVID-19.